Legislators to oppose a proposal by the Budget Committee to have a 30% blanket budget cut to raise 39.2 billion shillings for the health sector at a heated caucus meeting he convened at State House in Entebbe. Last week, MPs unanimously agreed that 260 billion shillings be found for the health sector, or else they will withhold approval of the budget. The Budget Committee was directed to propose the way forward, and it reported back that it had identified 39.2 billion shillings by cutting wasteful expenditure from a number of sectors, including the Ministry of Defense. Those who attended the State House caucus meeting say that the President insisted that the prime responsibility of any government is peace and security. He also rejected a proposal from donors to pay salaries of some health workers for 2 years and then to leave the government to take over, as had been explained by Health Minister Dr. Christine Ondoa. Towards the 2011 general election, several opinion polls, as well as the Citizens' Manifesto, indicated that some 80% of Ugandans want the health sector to be given priority, looking at the challenges it faces. Prime Minister Mama Babazi today re-echoed the government position in Parliament, rejecting a proposal to cut 15 billion shillings from the defense budget, 3 billion from the Electoral Commission and the Uganda Bureau of Statistics, arguing that the two agencies are statutory institutions with specific constitutional duties. In the hot debate chaired by Speaker Rebecca Kadaga, MPs opposed Mbabazi, saying that security is not enough if people who are supposed to be protected are sickly and dying. Parliament will tomorrow resume debate on the matter after the executive asked for more time to deal with a stalemate. This stalemate in Parliament has delayed the budget process, putting in danger delivery of services and the payment of salaries to public servants. So tonight we ask our MPs write in insisting on the budget cuts even after meeting the President. What exactly is the situation in the health sector to justify this standoff and demand for budget cuts? And also, what is likely to happen to the appropriation of the 2012-2013 budget since the standoff is delaying it? Our guests tonight: Hon Capt Mike Mukula, Soroti Municipality MP from the NRM party, also a former Minister of State for Health. You're most welcome, Honorable Mukula.
Good evening, listeners. It's a pleasure being on 90.0.
We also expect to be joined by Honorable Betty Amongi, Chairperson of the Uganda Women's Parliamentary Association, also Member of Parliament for Oyam South. She's from the Uganda People's Congress Party, UPC. Honorable Mike Mukula, what exactly are legislators demanding? Would you like to give us a recap of that?
Let me give you the background so that listeners can be able to appreciate the predicament that we face as a nation. When the presidents of Africa met in Abuja, it was agreed that the health budget in the sub-Saharan region mainly should be enhanced to a level of about 15% of the total budget of every nation in order to meet the challenges that were being faced in terms of addressing common good, in terms of ensuring that health for all would be guaranteed. And in that Abuja declaration, Uganda was a signatory. Now, you will note that over time, the projection by WHO, World Health Organization, was that African nations, more so Uganda, could be able to spend about 27% of its budget on health delivery and health care. World Bank, in this projection, had the assertion that it would be healthy for a nation like Uganda in order to attain what you call progressive growth and also work towards better health, spend about 34%. Now, you will note also that Uganda is one of the nations that is categorized as one of the least or developing nations. The United Nations laid down what you call a measure for transformation of a nation like Uganda. And they said, let us set what you call a roadmap to 2014 to 2015, and that roadmap would be the MDGs, Medium Development Goals, which will be set, Millennium Development Goals, which will be set to ensure that there are certain parameters that should be worked on in order for a nation like Uganda to gain what you call positive growth and take off. Now, you'll also realize that we have been faced with a number of factors. We have both the central government and the local government. The bulk of the money goes to the districts. And Uganda has got what you call a medium-term expenditure framework, the MTEF. It's a 3-year setup. And Uganda had what you call the Health Sector Strategic Development Plan 1 and 2. And in that setup, government of Uganda, working with the development partners, have what you call a basket arrangement program, where donors will put a bit of money into that basket, and Uganda then works out an arrangement for a progressive growth. Now, Uganda's allocation, the last time I checked, on health funding the highest it had moved to was 11.7% on the budget. Today, as we talk,
which year was this?
This was about 4 or 5 years ago. Today, as we talk, it has declined from 11.7% to now 7%. That's where it is. Now, what are we faced with? You will note that we have major challenges on the ground. We had managed to reduce, for example, you remember when Clinton came in here, our concern was Uganda was a nation that what was talked about all over the world in terms of the achievements on HIV and AIDS. Why has it that it has climbed? We reduced the prevalence from 30% to 6.1%. It is now hitting up. It is starting to climb. Why? I can tell you that we have, for example, this is one of the areas I will come back to later. You'll also note that if you look at the population growth, Uganda has the highest fertility rate of about 6.7%. We also have a high population growth as a result of the high fertility, which is about 3.2%.
Yes.
Now, let me give you that in figurative figures. In figures, Uganda every month produces an average of 100,000 children every month, meaning that we produce close to 1.2 million children every year. That's a huge number. Now, the same way you get HIV and AIDS is the same way you make babies. So let me give you a very interesting scenario.
Baby factories.
Let me give you a very interesting scenario. One of the critical points you'll get to understand is that with that high fertility rate, high population growth, Uganda's increase on HIV and AIDS and the number of people who are now on ARV is close to 500,000 people. What does that mean? It means therefore that there is the captive number is about 1.2 million people who are in this HIV AIDS bracket. But those who have progressed and now have got what you call full-blown AIDS is still not known until you get to know, you monitor what you call your sero status. I mean, you get to know your
whether you're positive or negative.
You get to know what's like positive or negative. But there are two major components: your viral load count and your CD4 count. Now, the moment you enter into the ART program, the antiretroviral treatment program, it means that your status must be monitored all the time to know your CD4 count, to know your viral load count. Now, there are districts that are so remote, like those in Bukedea, like in Kabale, and so on and so forth. I'll tell you, a district like Bukedea, a district like Serere, and so on and so forth, do not have a single doctor. So how do you monitor very complicated drugs? Because these are toxic drugs. The ART treatment is toxic. It cannot be prescribed by a single ordinary nurse or doctor. I mean, ordinary worker in the Ministry of Health. You need to have your status monitored all the time. You got to know your CD4 count. You got to know your viral load count, and somebody has got to monitor your health status all the time. Now, if you don't have somebody to dispense these drugs will remain in the stores. If not, if you are given the level of toxicity in the body and the resistance, the mutation of the virus will increase. Now, these are some of the problems we face. But let me crown it and put the icing into the cake. I want you to understand that the health sector is faced with a major problem of the patient-doctor ratio now. Uganda has got such a huge problem. Why is it that the maternal mortality has gone up? We have got over 14 to 17 women dying every day as a result of lack of adequate response and treatment.
Right.
Now, these are factors that we are now addressing, and that's why I would like to say my sister, Hon Amongi, who is the chairperson of UWOPA, who is speaking for the voiceless.
Right.
We are now championing the cause to say no. The time has come for us to speak for the voiceless,
right,
and ensure that there is a transformation in the self-delivery, whereas we need what you call the financial capital.
Right.
We also need the human capital, to match the two.
Okay, we'll go into that. Thank you. We've just been joined, listeners, by our second guest, Honorable Betty Amongi, Chairperson of the Uganda Women Parliamentarians Association-UWOPA, also Member of Parliament for Oyam South. You're most welcome, Honorable Amongi.
Thank you very much. Good evening, listeners.
Let's talk about this stalemate, this standoff in Parliament. Where do you people expect this money to come from to top up the health budget?
I think the Committee of Parliament did a very noble duty, the Budget Committee and the Health Committee, in helping government to reprioritize. And the role of Parliament is to look at the government budget and assess whether or not it meets the priority of the people. This time we felt that the biggest national question that is facing this country is health, the state of health care. Therefore, the committee went and looked at 9 core priorities. They cut the budget for workshops and seminars. They cut the budget for teas, budget for special meals, what they are calling special meals. They cut some budgets from defense, and we are saying at the moment Uganda is stable. We do not have any threat nationally. As our neighbors in the Great Lakes region, that budget which deals with international security has not been touched. Budget related to Somalia and so on. So in defense, they also looked at non-core issues and cut those budgets. So literally, where Parliament has touched are what we call wasteful expenditure. It's unfortunate that the Prime Minister still insists, but I am very, very glad that today in Parliament, across party line, across gender, across religion, Parliament has said we must address the crucial need of the population. Right. That is the health question.
All right.
And the statement of the Prime Minister did not even make any commitment. While he stated that there would be a commitment from government to recruit, because what we wanted out of the 260 billion was to employ more, recruit and enhance the salary of the current health workers and recruit additional health workers.
Right.
But the Prime Minister came and said we are committed to recruiting additional 1,000 midwives. But goes ahead to say we cannot cut the budget, so we shall bring a supplementary budget. And we are saying no. We wanted 260 billion. We failed to get 260 billion. We have now moved to 39.5 billion, which would at least enhance part of the salary and recruit additional midwives that can be placed at Health Center 2, 3, and 4.
All right.
So that is where Parliament has put its foot down, and I am very grateful and very hopeful that nobody is wavering, and I hope the Prime Minister and the Executive will go and reconsider and come back and adopt the cuts and their reallocation.
All right, we'll talk about the different sectors, the different areas where you think government needs to put money, whether it's in buildings, staff salaries, staff numbers, whether it's drugs, which specific sectors, maternal and child health, and so on. But first of all, you've asked them to reduce, you spoke about special meals, fewer number of sausages on the plate. Do you think the government is simply being insensitive when they refuse to, listen to your people?
I think first they are being insensitive because even the NRM members read the commitment of the manifesto of NRM, and those commitments were to the effect that they will enhance the salary of the health workers, they will recruit more, and they will make sure they build staff houses. So it is being insensitive because one Honorable Chris Biarmosi told the Prime Minister that in my house I have 4 patients, 2 of them from your own constituency, Honorable Prime Minister. What do you want us to do? We have become hospitals. Members of Parliament have become hospitals. You people, everybody in the private sector, in government, you have become caregivers because the non-functionality of the healthcare. And they know, and the ministry, the sector ministry, came before us and said, if we are to transform the health sector, this is what we need. Priority number 1, human resource. Number 2, human resource. Number 3, human resource. And we have been making noise as Uganda women's parliamentarians. Women are dying. We ask the question, why are doctors neglecting women?
16 women are dying.
Yeah, but even the circumstance where a woman goes to the hospital and the doctor asks for a bride, we say, why can't you discipline? What is it that you, Minister of Health, is failing to do that a doctor can reject to treat a pregnant woman in labor and she has to die because of labor? And they said, there's nothing much we can do because a doctor is paid maybe 500,000 shillings or 1 million. It depends. 1 million is when a district is topping up. But the salary from government cannot sustain the doctor. So what have they decided to do? They have decided now to resort to asking for consultation outside from the patient. And this local woman goes to give birth, doesn't have any money. It's not something you can suspend. She will end up dead because the doctor cannot take care of her, cannot operate. So it is being insensitive on the part of the Prime Minister. I know that the ministry, because we have interfaced with the ministry said our hands are tied because finance has said there's no money. Now we want to turn to finance and say, well, Parliament says there's money and there must be money, and this is the priority. Right. That is where we are.
Well, we also heard that what they call special meals, specifically in the defense budget, is classified expenditure, hidden things that they don't want ordinary mortals to disclose and discover. Honorable Mukula, you are in the NRM caucus. Yesterday we were told that you agreed with the president, even though you disagreed at the start. Why do you come to Parliament and turn around NRM MPs?
Well, I think, to me, the Parliament has got 3 major functions: oversight, allocation, and policy in terms of law legislation. Now, yesterday in the caucus, we agreed on the following terms. 1, under the Budget Act, the functions of Parliament normally are guided by the Budget Act, and it's a constitutional mandate. Now, there is normally in the Budget Act there are projections in which Minister of Finance sends in what you call a framework. That framework is sent to committees. The committees then put that into context, and the Speaker will submit that to Minister of Finance or through the President, then to Executive, and then they develop that framework. Just to give you a brief background. Now, we have now come at the tail end, and we saw that the argument was it may not be possible now for Parliament to make amendments to this act that they made on their own and do it at the tail end. The compromise was go and pass the budget, but we make the undertaking as government to the following effect. 1, first of all, there are scenarios that were built. The Minister of Health proposed that there are donors who are willing to come in and, for example, ring fence that area of expenditure, salaries, wages, and so on, right, so that we could go ahead and recruit. That was one scenario, and they're prepared to run it under the MTEP the next 3 years. But obviously, you know, when you recruit, you must sustain that over a period of time. You cannot pay somebody for 2 years or 3 years. And what do you do with them or her after?
Right.
The second scenario was, why don't we compound it, put it together? and agree that one, since we have now agreed, can we now re-amend using the Budget Act, identify resources from elsewhere in the Budget Act,
Right.
ensure that we now accommodate this area.
Okay.
Okay? So that the commitment is in, because after all, you know, either in the local government or the central government, the options are that when you advertise for these positions, it takes you maybe 3 months to 4 to 6 months to recruit the full staff until they are brought on board to function in government.
Right.
By the time you do that, and the time they get the appointment letters, the year has gone
it's
round.
a technical. Well, let's take a break now. We'll get back and then scrutinize these matters, dissect them properly for the average person to understand. We'll be back. This is Spectrum on Radio 1. Stay tuned, please.
Everybody talking like this in the car, this in the bar. Doesn't even matter wherever you are. With Overload, what you really don't know is good. You get a little bit more.
A little longer. Send text to all your loved ones and love a little longer.
Get 15% extra airtime guaranteed every time you roll with MTN. Simply dial *145#. Get talking all day up to midnight with MTN Overload. MTN. Everywhere you go.
When I sleep in the night, I feel my soul come alive. Memories gliding back. I climb the hills of Chipisi. I see the walls of Chibu. I hear the roar of the lion. The lion in me. When I sip from the Nile.
As we celebrate 50 special years, Nile Special invites you to toast to our great land. Nile Special, the rich, rewarding taste from the source. You've earned it.
When I sip from the Nile.
Not for sale to persons under 18.
Spectrum on Radio 1 FM 90.
Welcome back on Spectrum tonight. The standoff between the executive and parliament over proposed budget cuts towards the health sector. Why are the two sides failing to agree, and what will this mean in the end? Our guests tonight, Hon Capt Mike Mukula, Soroti Municipality MP, coming from the NRM party, is a former Minister of State for Health. Hon Amongi, Chairperson of the Uganda Women's Parliamentarians Association-UWOPA. She's also Member of Parliament for Oyam South, coming from the Uganda People's Congress Party. They built hospitals. Can you talk to us very briefly about the hospitals that UPC built? We built about 22 hospitals.
Yeah, actually, it's appalling that we toured. Actually, what is making members come out? We toured hospitals as women parliamentarians, and we went through all these 22 original hospitals built under UPC. Very beautiful structures on the highway, very central, but too dilapidated without staff. We were in Kiriandongo, very beautiful hospital. You go to this one, Chankwanzi, you go in the west. The structure is there.
Built by UPC.
Built by
many
UPC,
years ago.
Many years ago. But it's now dilapidated. The equipment's there. The old equipments are the one being used, rusted. And you see, and you say, really, where do we want to go? And that is why, the reason why members are putting their foot down is that they have seen and they continue to see the suffering the local people are undergoing because of lack of medical equipment. Their situation, you have a doctor, but then you reach there, the doctor doesn't have equipment to investigate your condition. You know, there are circumstances you go and the equipment and there's no doctor. So the linkages in health care is so central that the pain, people who are getting more pain is us, the MPs. Because someone falls sick, fails to go, you goes to our hospital, doesn't get treatment, we'll call the area MP, we'll call the councillor. So good enough, we secured some loan to renovate some of those old hospitals,
the UPC hospitals,
and transform them, if possible, into regional referrals. Most of them actually are at the level of regional referral
yes.
When you look at them. So the Prime Minister, I think, And I hope that by the time he comes back tomorrow, he will be sober.
Oh, what do you mean he will be sober? He was in Parliament today. What had happened?
No, today in Parliament, he made a commitment. Actually, last time when we stood over this matter, he was told to go and look for where the money would be. Because budget committee had already made their cuts from originally travel abroad, travel inland, general supplies of goods, advertisement, and so on. Non-core area. But he goes back, instead of coming back with saying that of the 39, I think I can concede on this amount. Because we came from 260 billion we wanted to 39, which are non-core. But today the Prime Minister comes without any single, he actually says that Parliament doesn't have the legal authority
to question those things,
to change the budget and to make the reallocation, which was legally untenable argument on his side. That's why, maybe that's why NRM MPs became even more annoyed by saying we don't have the powers, and yet the powers is there under the law. Both the rules of procedure of Parliament, the Constitution, and the Budget Act, that we are the one who appropriate. And in appropriation, you
the
can...
Prime Minister said it's none of your business.
No, it's not. He says it's none of our business. He says his commitment and government is to recruit more 1,000 midwives, but it will come in the supplementary, and it will also come from cuts from within the Ministry of Health.
Not from elsewhere.
But we have sat with the Ministry of Health before to try and cut where,
and you can't
look at where to cut the budget. We failed. We failed to cut the budget.
Money has come from elsewhere.
Money has to come from elsewhere. Yeah.
Hon Mike Mukula, could you talk to us about this proposal by donors to provide pay for certain health workers for about 2 years? Why is the government jittery? Why don't they want to accept it? Free money for that matter.
Well, you see, Uganda is now funding this budget now, total, by about 73%, which has been a very tremendous progress. And when you look at the core areas of funding, one of the key things that Uganda and the National Resistance Movement is trying to avoid, to get into, is getting into conditionalities. That is one core basic thing, because it is, it's a bullet which is sugar coated. It has got many things. Many things come with this.
The aid money.
The aid money.
Term limits and other things.
Now,
governance. Well, they might ask them to be restored.
Well,
we don't know. Maybe
and it will be to your advantage.
Well, we will discuss.
Political discussion tonight.
But the most fundamental thing is that since government of Uganda is looking at a transition, we are looking at moving towards almost close to 100% self-reliance, especially with now money, the oil that we have discovered. You have also known that the discovery gives Uganda almost close to 3 billion barrels.
3.5 years.
3.5. That is a huge discovery. So the leadership has got to be very careful and to be cautious about that kind of
not to bring visitors.
But to me,
I will ask for term limits.
But to me, what is very fundamental, what is very important that we need to capture here is that we are faced with a major problem on the ground. The country, when you look at the other day, we were listening to a testimony of one of the members of parliament from Karamoja, who had an Health Center 3, where you had a nurse who went out on a maternity leave and came to Tororo. And there was a watchman, a security,
who became a doctor.
Who became, now, he was the one giving out, the drugs were there, we have enough drugs, but now, the security man was the one who was giving out the drugs. This was the testimony of one of the members of parliament yesterday. Now, to me, what I think we need to do is come out to the reality. Some of the people, some of the bureaucrats who are in the Ministry of Finance, with all due respect, who are Ministry of Health and so on, sit in Kampala and do not know what the members of parliament are faced with on the ground. And when you see the response which is spontaneous across the political divide, it is because of the pressures they are facing. Because you will see that, for me, I can tell you honestly, if you look at a major machine which you lose for analysis, it's called a CT scan.
Yes.
In Mulago. It's been there for over 10 years. Kenya has advanced beyond a CT scan now to what you call the MRI. The MRI, Kenya as a government, for the whole country, has 14 of them. Rwanda has, I think, between 2 to 3. But in order for you to get what you call correct analysis for the doctors,
you need a minimum of a CT scan.
You need a CT scan. Now, you look at the whole country. It is projected by the year 2020, non-communicable diseases and communicable diseases will be at par, which means that things like diabetes, cancer, pressures and so on will be almost at par with malaria and so on. Because look at it this way. Infant mortality a few years back, less than 3-4 years back, was 120 babies who are dying out of 1,000. It has dropped to 54.
Yes.
Maternal mortality had dropped to 432. It has now gone up to 400 and something. It has gone up again. Now, that concern of the mothers is what we are talking about. HIV and AIDS has gone up. Now, all these are figures or factors that tell you that when the antennas are up,
right,
we need to come out and look at the issues and address the issues. Short of that,
there's going to be a problem.
There's going to be a problem.
We're talking about the sick man of East Africa. We're going to move into a major crisis. In actual fact, we are at a crisis level now. The sick man of East Africa. You said Rwanda is better off than us. They seem to be very organized. Not
Don't forget,
plain streets.
Rwanda has what you call a very excellent health insurance scheme
for everyone.
Tanzania has the same. Kenya has a very progressive health insurance scheme which they have just introduced. They're moving very well. Uganda has still got its policy or the law in a shelf.
Well, Uganda is just coming from war. We just got a change only 6 years ago. Maybe we're still recovering. However, Amongi, which are the areas that one needs to look at? Give us some more emphasis on that.
In the area of health sector?
Well, do we need buildings? Do we need drugs? Do we need people?
What the first important priority for health sector now is the human resource. Those are one, you need the midwives.
We need the doctors.
At health center, because the structure of health center is that for preventive care preventive care and other curative care is mostly at health center 2, health center 3, health center 4. Health center 4 is at the level of county. So at each health center 2 and 3, we need at least a minimum of 2 midwives. At the level of health center 3, you need at least a minimum of 5 midwives or nurses with a clinician. At the level of health center 4, you need a doctor, a minimum of a doctor, but recommended should be 2, with an ambulance.
Oh.
Yes.
Working
ambulance, that should be in all county. That is health center 4. But the checklist, when we even ask Ministry of Health, can you give us the checklist of ambulances, functional ambulances throughout the country? They didn't have.
We see some of them in newspapers.
They didn't give us. They said we don't have the record. 2.
There's a record in the newspapers. Most of them are packed, worn out and all.
In the fact, let me even tell you more interesting things. Sorry to cut you.
Yes.
The district in Buheju, in the western part of Uganda, its human resource cover is at a very low minimum. It's the lowest in the country, between 19 and 20%.
That's where Honorable Bureau comes from.
In fact, for where my sister comes from, Lira has got the highest. Lira Referral Hospital, 86%.
So if you look at the statistic, the human resource statistic, you find an average of between, majority of the health centers have between 25, 40 to 50 of the needed human resource required. So it means the rest of the 50% of the lack of human resource, the effect will be on the population. That they cannot, they will go to the hospital and find nobody.
The politicians take over. The security men become doctors. There's a book I bought from Nairobi many years ago. It's called Where There's No Doctor. So maybe they should use those books.
And that is the role we are asserting, that members of parliament who knows what is happening on the ground must assert its authority, represent the interest of the people, and in this circumstance, the interest of the people is that we want good health care. At least minimum, somebody should be able to access a nurse at health center 2. Minimum, somebody should be able to access a doctor at health center 4. Referral, most diseases, most complication cannot move from health center 3 or 4 to referral in time. That is why most people are dying. That's why increase in maternal health is manifesting, because the ambulance that should take a woman who is pregnant and in labor from health center 4 is not there. If it's there, they will tell you there's no fuel. If the fuel is there, they will say there's no driver. So that's why most members of parliament are now buying ambulances. You've seen.
Better numbers that did it in Mukono.
Yes, you saw it. I am running an ambulance service. Actually, I am running a program that I moved to rural villages to screen cancer, to carry out palliative care. This should not be my role.
Maybe they should raise your salaries, MPs. Maybe you provide services better than...
For me, I am happy
some structures.
That for the first time now, you're having Parliament, which is coming in, to look at the detail as to where each shilling is going to. This is a major transformation in the oversight function.
You could call it the fundamental change.
The country is now getting into issue-based politics.
Right.
You have seen that in United States, the key issues Obama is faced with is the economy and health. Now, Uganda, to me, this is good progress in terms of the political evolution.
All right, let's hear from the listeners. You can call the fundamental change, or even give it a better name. This is Spectrum Radio 1. You can call in now. Our numbers 0414-348-111, 031-226-0390, 031-226-1390. When you call in, please tell us your name and where you are calling from. Spectrum, hello.
Hello.
Yes, sir. Your name?
My name is Dr. Warren.
Dr. Warren.
Yes.
Spectrum, hello. Well, strong statements. They're coming apparently from the heart of a medical practitioner. Spectrum, hello.
Hello?
Yes, sir. Your name?
Edmond, good evening.
Good evening. Your name again?
Yeah, thanks for the guest in the studio. Very happy to hear that the Honorable Mike Mukula and Honorable Amongi. One.
You didn't tell us who exactly you're referring to. Spectrum, hello?
Yes. Thank you very much for nice program.
Your name?
I'm called Vicente.
Spectrum, hello. Good evening, your name? Sure, maybe you'll decipher that message for us. Spectrum, hello. Hello. Okay. Our final caller. Hello. Yes, sir. Good evening, your name?
My name is James Kashaya.
Mr. Kashaya, yes.
Thank you for that.
Okay, thank you very much, Mr. James Kashaya. Let's get back to the studio. Honorable Betty Amongi. There are other competing needs.
One, let me tell the caller that we did not introduce this matter only at this time. This matter was in the recommendation of the Committee on Health, which I sit in, for the last 2 years. Last financial year, we had a very, very big fight over this matter and the salaries of teachers, until the Prime Minister came and made a pledge on the issue of teacher increment of 30% this financial year, and also saying the issue of doctors, they will deal with it in this financial year. There is what we call MTEF. Before we come to the final budget, we sit between April to May to look at the preliminary budgets in each sector.
That's the 3-year budget.
Midterm review, but we also before there's a framework which Parliament sits before the actual budget. We sat in April and we called the Minister of Finance and said, during the budget, make sure you factor in the 260 billion for the health workers. We told the Minister on Doha that if you come back without this increment, we are going to defy the executive and we shall not pass this budget. So this is not a matter of no, right. It has been building up. On the issue of priority, I want to tell the caller that yes, it is good that he realizes that priority number 1 must be health. He stated that. That is good. But we are not only talking about doctors. We have been talking about teachers. We have been talking about other civil servants. So
even policemen.
Even police, we have been making noise on police, on
with
prisons.
Their uniforms.
So I think for us, we have said we have talked enough. This time we must ensure that what is the core of priority, because you cannot teach when you are unhealthy. You cannot fight in Somalia when you are unhealthy.
Or even on the streets, keeping land or
you can't move. So what is important for each one of us is when you wake up in the morning to go and perform a task, whether digging, whether going to the office, you must be healthy.
All right.
So that is the single most security of every individual is health. That's why we are saying, if there is no money at all to enhance across board, please start with this category, the health, the teacher, and we move on.
Honorable Mike Mukula, you are one state minister for health.
Well, to me, let's look at it this way. The standoff has come off from really pressures, as I said earlier.
From below.
From below. And what you see, when you see the response of the leaders on the ground, they are speaking based on the pressures they're facing on the ground. That's a fact. But I agree with the callers. Some of the callers, like Dr. Tomwine, has got a point that a doctor who spends 6 years in medical school,
an internship,
then comes up to earn 600, 700,000, even with the taxes. That is too low, really.
Before tax.
Now, some of these the doctors are now being attracted to neighboring nations. Some are even going as far as South Africa. The other day, one of the vice presidents was going in for an operation in London.
Yeah.
You'll be surprised that the operation was carried out by a Ugandan, Dr. Lalobo. This is surprising. One of the doctors who operated on the President of the United States, that time Reagan, when he was shot in Washington, one of them was a Ugandan to remove the bullet from which had lodged in the body. So I want to tell you that we have a very, very professional team. We need to retain these people. But you see, what you call the sectors across board are very critical. Let me tell you, there are 3 key pillars of government: the judiciary, the legislature, and the executive. The legislature and the executive are reasonably looked after well. But let me give you the example of the judiciary.
Yes.
Let's not be selfish.
The magistrates.
The Supreme Court alone, including the Chief Justice, Justice Odoki, put together earn less than 45 million shillings. Actually, 45 million shillings, yes. But you'll find that one leader in one of the sectors, for example,
an executive director, for instance,
executive director, say, of KCCA,
43 million every month.
He earns more money than all these judges, including put together. So we are saying that obviously the executive director must be paid very well, no doubt, because she's got a very, very difficult and challenging job. But where do we start from? And these are the critical issues now. Where do we set priorities? I think critical point number 1 in government is to deal with defense. Let's ensure that there is adequate security, because the platform of all these achievements that have been made is a result of national security. That's number 1. Number 2 is that let's deal with the scientists. No nation in the world has transformed without looking after its scientists. And that's why I think that doctors, those who are carrying out research and so on and so forth, are very critical. I'll tell you one thing. I did political and economic reform in Harvard, one of the best universities in the world.
Yes.
This political and economic reform has got its own very clear framework. The pyramid must be allowed to stand on its key priorities.
Yes.
And if you invert the pyramid,
it falls.
It falls.
We have to go. Thank you very much, Honorable Captain Mike Mukula, very knowledgeable. Soroti Municipality MP, coming from the NRM party, also former State Minister of Health. Thank you very much for coming to Spectrum tonight, sir. Honorable Betty Amongi, Chairperson of the Uganda Women Parliamentarians Association, also Member of Parliament for Oyam South, coming from the Uganda People's Congress Party. Honorable Mukula, before we go, what do you think, what can we expect to see in Parliament in the coming days?
I see that obviously there's got to be a compromise. And the budget will have to be passed, because you see we are now getting into what you call the constitutional deadline. If we don't pass the budget, it means that we'll have to amend the constitution at a certain point. So it is important that some sort of compromise is arrived at, because we already passed the two weeks that are embedded encased in the constitution.
All right,
finally, I want to say that I think we'll have to sit down, agree with the leadership again, a working committee, in order to ensure that we have a long-term framework of addressing the salaries of doctors, addressing the salaries of nurses, and increasing the capacity of health to treat our people, especially the downtrodden.
Thank you for tuning in. I've been your host, Edmond. Kizito Spectrum. We'll be back tomorrow. Up next is the news.
Hello, Uganda. This is Regina Bell. And for my very first time ever, I'll be in Kampala for the 5th annual Now Gold Jazz Safari.